Could you talk a little bit about like kind of the complexity of what's going on with your lower back, like why it's hard to like self-diagnose or why it's worthwhile to go see somebody who knows what's going on?
So mostly the difficulty lies in the wide variety and the potential severity.
Mm-hmm.
So like if you have an issue like you had, for example, where you have a for sure disc herniation, you have radicular symptoms, you have neurologic weakness, like all of those kinds of things are red flag scenarios. Not necessarily red flag in a surgical sense, but they're red flags like, hey, we probably really need to investigate this further and not just leave you at bay.
Right.
So, in her defense, in your initial doctor's defense, a lot of low back pain or a lot of musculoskeletal injuries in general will heal on their own in 8 to 12 weeks just because pain has a natural history, right? Performance doesn't. So if you're an athlete and you get an injury like that, you're going to become detrained and the pain may go away, but the performance aspect doesn't come back on its own. You really like you have to retrain that.
That's really interesting. I'd love to get on that, expand that a little bit more later.
Yeah, so that's one aspect of it. The other thing is there's so many different, like I said, there's so many different types of injuries, and the low back and lumbopelvic complex just is involved in so many different things that you have to really be able to narrow it down. And a lot of it is, like I said, red flag scenario. So if you have low back pain that comes with any kind of urinary incontinence or bilateral leg numbness and tingling um, or pain that's worse with rest and worse at night. Like there are a bunch of different red flag scenarios that your normal personal trainer that says that they can help you with back pain just doesn't quite have the education to understand whether that's a disc herniation or an unstable spondylolisthesis, which can be very detrimental. Like that's something that happens in like young female gymnasts and divers and people that spend a lot of time impacting in that hyperextended position. Football players also get that quite often.
Yeah, yeah, it's a scaffold a little bit. You're talking about on the vertebrae, it's got like the three processes that come off of it, and sometimes one of them will like break off of there and kind of like float
So
in the
no,
or,
not
or are you
the.
talking about
So you
go
have a
ahead.
spinous process that sticks out the back like
Hmm.
this, and then you have transverse processes.
Right.
And then your spinal cord kind of goes down through the middle. I looked to see because I used to have a spine model in my garage, but I lent it to a friend who's in grad school, so I don't have it anymore.
Yeah.
But and then your spinal cord kind of goes right down the middle. So
Hmm.
it connects to the vertebral body with um, two other pieces of bone called pedicles. And if you the unstable spondies, you'll fracture one or both of those pedicles, and then your vertebral body can shift forward, so it's no longer kind of in that arch line anymore. The bottom will kind of stick forward quite a bit. And if it's unstable, it can really lead to major complications. Like major, it's already a surgical complication if you have an unstable spondy. They'll put some screws in there, kind of pull it back into place, and it won't move anymore, but you're also
You
not
post surgery after at that
not
point.
at risk anymore.
Yeah, yeah.
But yeah, so if that continues to get worse and worse, it can lead to some really major complications outside of just ow my back hurts.
Hmm.
Um, but yeah, it's really complicated. Not all of it is pathological from a tissue standpoint. A lot of it, I'm sure you guys have heard of the biopsychosocial model.
Hmm.
A lot of it has to do with how much stress you're in. Is your wife leaving you? Do you have kids that are keeping you up at night? Is your sleep schedule terrible? Is your work life not good? Did you lose your job? All of those things can play into particularly chronic low back pain. And treating those things is really difficult. And I feel like a lot of those types of people look for solutions on the internet because they've been to their primary doctor, they've been through physical therapy, and maybe not all of those things have worked. So they'll find someone who's really good at marketing and can really elaborate their point clearly on social media, and they'll hire these guys, but still these guys really aren't qualified to help. And then those patients will turn to the surgical route.
Hmm.
And then once you go the surgical route, you're never coming back.
Yeah.
Um, if
That
you have
was
a spinal fusion, the odds of you having a second one within 5 years are about 60%.
yeah,
So
yeah.
it's not great outcomes on that end either.